Hey guys, I'm Tank JW and welcome to Operate Now, Appendix Surgery. I'm pretty certain I'm not qualified for this, but you know, I had to go at the wrist or arm surgery one, and that was pretty cool. But meet Tara. Tara was brought to the hospital because of a severe stomach ache. She may have appendicitis, which is possibly a life-threatening condition. You need to examine her, and depending on your diagnosis, we may need to take her to the operating room. Right, nurse. We will first check if the patient is experiencing pain due to inflammation of the appendix, or appendicitis as it's called. Let's do this, man. Apply some pressure to the area where the appendix is located to see if it hurts. Where's it located? Definitely seems to be in a lot of pain. This is a possible sign of appendicitis. Let's do a blood test to confirm. Cotton ball. No. First pick up the... Yeah, alright, the tourniquet and wrap it around the patient's arm. Where's that? Oh, yeah. Now pull the strap. Oh, yes. Now tap the forearm to make the vein visible. Oh, there you go, baby. Now we're going to grate the veins clear visible. Let's disinfect the area now. First select the tongues. Tongues. Now dip the cotton ball in antiseptic solution. Oh, yeah, baby. I'm looking straight after you. Now that the area is clean, you can pick up the needle and carefully insert it into the patient's arm. I feel sick. Take an empty file and attach it to the other end of the needle. Oh yes. Actually, I had this done the other day. It's horrible. Now we have our sample. You can remove the needle from the patient's arm. Oh my god, I'm so sorry. Apply a plaster. There you go, little girl. Very good. We can now check the patient's blood for appendicitis. Alright. We will now examine the patient's blood for an increase in white blood cells. White blood cells protect the body from harmful outside influences. Excuse me. If there is an increase in white blood cells, it might be an indication that there is a dangerous inflammation in the body. No more than 8 white blood cells should be visible in the microscope. Please check the white blood cells count and tell me if it's normal. Well, it's not. Too high. I agree, doctor. The normally high white blood cell count indicates that there is a very high probability that she's suffering from appendicitis. Since there is a high probability that our patient is suffering from an inflamed appendix, we will surgically remove it today. No messing about. Please get the scalpel. We're going to put her to sleep first. Oh. Very good. Now pick up the retractors. They will keep the incision open. Oh. Good. Use the scalpel to cut through the fat layer. Shit. Oh my god. Cause basically quickly soak up the blood. Ah! With a piece of cloth. Come on. Now pick up the cauterizer and use it to close the bleeding vein. Oh yeah. Great, the bleeding stopped. Grab the scalpel so we can continue the surgery. Is that it? Great, pick up the scissors and use them to enlarge the opening. Why don't we just... That's scissors? Alright, it's not scissors, it's tweezers. Good way to remove the retractors. Place them in the centre hole and pull it open. The tissue may tear a little, but that's okay. A little. We will now use the scissors to wedge the muscle out of the way. I honestly feel sick. The muscle layer has successfully been opened. Grab another pair of retractors. Oh my word. It's one layer away. You need to be extra careful when cutting the next layer. Directly under it lie the intestines. If not carefully cut, you could puncture the patient's bowels. Pick up the pair of tweezers so we can lift the peritoneum up a bit. Grab another pair of tweezers, doctor. I see where this is. We're going to lift it so you create like a gap. Great, take out the scissors and make a small cut. It's quite intense, this. Tear the cut open with your fingers. Excellent work, doctor. We can now pull out the appendix. We're now going to pull out the appendix. We're now going to pull the appendix out of the patient's body so we can treat it. It seems that the appendix is sticking to the intestine. Grab the appendix with your fingers. Great work, doctor. Now grab the intestine and pull it out. Why have I got to pull the intestine out? Great work, doctor. We were right to operate. The patient's appendix is infected and needs to be removed. Grab the tweezers, doctor. Great work, doctor. I'll hold it up so you can take another pair of tweezers and clamp them to the base. Good work. Now the infected fluids can't flow back into the bowels when we begin cutting. I really don't want to cut it. Take a pair of scissors and cut the tissue just above the tweezers. Great. Now let's close the wound. Pick up the needle. Did anything even happen? Didn't come off, did it? Nice work, doctor. Now remove the tweezers. Ah, see. Now we're going to cut the entire appendix off. There you go. Great, the appendix has been removed. Secure the wound with the needle so we can put it back in the patient's body. Excellent work, doctor. Remove the tweezers and push everything back inside. Push it back inside. Yep, you can go in there. Retract the retractors. Pick up the needle, doctor. Poor little bastard. I thought they did it keyhole these days. Great work, doctor. Now put a patch on it and we're done. New mode unlocked. Thanks, Doc. I made 3 mistakes, love. Don't you just thank me yet. Do you know what I mean? But at the end of the day, I think you should be able to go home today. Just take the course of antibiotics it will give you. Try not to do any strenuous work. And yeah, go back to school in a fortnight. Okay? Bye-bye. Anyway, guys, that's where I'm going to leave it because that's the end of the game. Thank you very much for watching. Don't forget to subscribe on your way out. If you like it, share it. Do what you want with it. Don't keep it, because it's mine. I'll see all you guys in the next video. To work properly, it needs to be screwed onto the bone. Use a drill to make the holes. I've got to drill this person. I'm drilling her. Drill her twice. Drill her 3 times. Drill her 4 times. I've drilled her 5 times. I'm gonna go for a 6. Use. Good job, Doc. Now insert the screws. And now I'm screwing her. I've drilled her. Now I'm gonna screw her. Oh yes. Speed run. The fastest surgeon in the world, Dr. Tank. Good job, now insert the screws. I've done that. Alright, I'd like to screw down. Come on. 31 beats per minute. We've got plenty of time.